Hello everybody, my name is Martin Parker. I'm a professor at the University of Bristol Business School, and this is the Transforming Society podcast. Today, I'm joined by two authors who've just edited a book called Under Investigation, Transforming Disciplinary Practice in the Workplace. So it's my pleasure to spend some time and have a conversation with Andrew Cooper, who's Head of Programmes for Employee Wellbeing in the Aneurin Bevan Health Board in NHS Wales. He's also Development Director for the Healthcare People Management Association's Avoiding Harm programme in the UK, and holds an honorary research role with the University of Plymouth, leading a programme of research exploring the impact of the disciplinary process on individuals and organisations. With Andrew is Adrian Neal, who is the co-editor of this volume. He's a consultant clinical psychologist and head of employee wellbeing at the Aneurin Bevan University Health Board in Wales. Initially working in NHS adult mental health services, he specialised in employee wellbeing after completing an MSc in occupational psychology. Adrian's been involved in a number of collaborative projects across the UK, including health, education, government, and the emergency services. So welcome both, and really looking forward to having a conversation about the book you've edited here. Could you just start off by, I suppose, imagine you're at a party and you're just going to give somebody the kind of one paragraph summary of what the book is doing. So Andrew, do you want to kick off with this?
Yes, certainly. And thanks, Martin, for the invitation on today's podcast.
A pleasure.
I guess in terms of the basis of the book was taking perhaps a novel approach to the disciplinary policy and process and looking at it more from the impact of the application on individuals taken through it, individuals involved in the process. They might be the investigators, they might be HR colleagues, all the way through to perhaps that impact that it might have on the organisation's culture. And certainly as we've sought to build a case for examining the disciplinary policy and process in a new way, considering what that impact looks like on perhaps the economic impact to an organisation. And then on that last piece, to really look at how does this impact service users, clients, customers, if we don't get it right.
Yeah, that's really nice. Just to follow that up, Andrew, one of the things I was very quickly struck by is that I'd kind of opened this book assuming you were going to be talking mostly about the person who was the subject of the disciplinary practice. But as you indicated very clearly there, you see the potential for harm being much more ramified than that, almost like a kind of a series of concentric circles. I think you used that diagram at some point, didn't you? Go radiating out from that person right through the people who are investigating and society more broadly. This was as a result of your own observations, your own practice, that you started to understand the problems in that way?
It certainly started with the individual at the centre of the process, and Adrian will talk more about that. It certainly started with how somebody was being impacted and that significant harm. But I guess we've been working on this programme for the last 3 or 4 years. And the deeper we got into it, the more conversations we had with colleagues. We would have colleagues coming up to us, whether they were HR investigating officers, saying, we're actually harmed by this process too, from that sense of perhaps seeing sensitive information, seeing distressing material in terms of an investigation, but also being impacted by looking on at the person going through that process and kind of managing that distress and anxiety in another person. So absolutely, it started with the individual at the centre. But as we've sought to understand the issue and certainly sought to try and bring change, the picture got wider and we needed to understand it in a much broader way.
So Adrian, I mean, in your practice as an organisational psychologist, you saw the kind of what I just described as a kind of ramified, almost sort of a network of harm in a way, something along those lines?
Yeah, absolutely. I guess the easiest route is just years of exposure to people, employees seeking help for psychological symptoms associated with being involved in these processes. So very direct first-hand experience of that, including how difficult it is actually to reduce those symptoms while these processes go on. Not unlike legal processes in the criminal civilian world. These are imposed structures, processes that directly impact people's quality of life and do for some lead to mental health problems, which, is not often, kind of talked about. So there's a very clear link there. I guess the other angle is also seeing a kind of more diffuse systemic impact. So with that kind of more organizational kind of lens, looking at the impact on teams. So back to your initial question, if you were to be talking at a dinner party and, somebody asked you about the book, the odds are they would know somebody that had been involved in a process, if it wasn't them themselves, but they could even vicariously could tell you about the impact it had on that small working system. So for me, these are two things that are avoidable: is the mitigating or reducing or even preventing the impact on the individual, and then also doing the same with the system. And then if you look at these big kind of creatures, these big systems like health systems, it's usually health critical work, highly sensitive. Funding is usually an issue. You lose one or two people and you start having an impact on patients. So then you start to see the ripple effect, those concentric circles. So I guess where Andrew and I are looking at this have been from different angles, but seeing this ripple of harm, which in our eyes very often is avoidable, which once you've got into that headspace, it's quite a tricky one not to think about. So that would be my angle.
So you're working alongside each other, and you're having conversations about the problems that you're seeing, but presumably from slightly different emphases. Adrian, primarily in terms of ideas from psychology, Andrew, more HR-y stuff, I guess. Yeah, something like that.
So no, my background has been in the patient safety movement. I spent about 8 or 9 years working in patient safety, which recognised that often a lot of harm that was done to patients certainly wasn't negligent or malicious, but it was very much around, Adrian touched on, working in complex systems, that often systems didn't join up, so one didn't talk to the other, and things got missed and things got overlooked. And the patient safety movement's been established for the last 40, 50 years, and it's been really trying to do the join up better, to make patient care safer. And I guess what we drew across from the patient safety, and certainly a focus on avoidable patient harm, is what does avoidable employee harm look like? Are we doing things to our employees that if we just stopped and paused, reflected on the system in which they were happening, that actually we could reduce some of that harm? So my background has been very much influenced by the patient safety movement, a real desire and commitment there to make healthcare safer. But actually, it didn't take too much to nudge it into organisational processes, application of HR policy and process, to see where the join-up was, and in a sense how we could have a similar conversation.
Well, that's really interesting, and a really productive way of thinking about how you two might be working on a complex problem. So just spinning forward a bit then. So we talked about the kind of, if you like, the sort of the setup. Next, I guess, is to get into the detail of some of these stories, because your book is a book of stories, yeah. And there's, a sense, I think, in which, in order to get listeners to this podcast and potential readers of the book in the same space, you need to give us a flavour of these kind of stories. So are there some that particularly kind of, stand out as being interesting or affecting accounts that you'd want to share with the people who are listening?
It's interesting that you describe the book as a collection of stories. I didn't think of it that way, but I think you're right. It's very embedded in examples and case studies and kind of narratives that we've drawn from. It's an interesting question, because I'm actually, for me, I had a meeting with somebody last week who is caught up in a process, and so for me, there's stories everywhere. They're kind of absolutely permeate my my experience of my work. And I've been in post 11 years now. And one of the reasons, I guess, and looking back, it's always interesting to join the dots. Even before Andrew and I had met, my interest in the impact of organizational processes on employees was there. So I initially looked at the impact of organizational change. This is going back probably 15 years. When I was doing my organizational psychology masters, as a kind of move across from clinical psychology, I was looking at the impact of organizational change on a small team, and it is surprisingly similar to what we're seeing now through the grievance. But in terms of maybe the best example is actually a paper we published, one of our first papers, and it does make its way into the book in various ways, but it's the Alex story. But it was a case study, a real case study that we took a 360-degree lens at. So we had 8 different professionals or professional groups look at the single case study. And it was really our first venture into understanding the breadth of impact. So there was, as you said, there was the obvious one. The thing you think first was the impact on the person's mental health. So we had a clinical psychologist, not me, look at it, but we went all the way through to GP, a leadership consultant, a health economist, an HR consultant. So we had a look at it right across the spectrum, and I think it both gave us confidence that there was mileage in this, but also it kind of opened the door to the range of possibility. Although at heart I'm a clinician, working in the wellbeing sector, the door's usually kind of, or the horse is bolted usually. You're doing work to help people recover from, generally, if it's work related, if the issue is. Whereas this we see as the opportunity to do something which is quite rare, which is prevention. So if you can do this and prevent even 50%, let's say, that's huge. That's in the wellbeing sector, that is massive, because you are preventing exposure to this. But you can also mitigate. So those 50% people that do then get exposed to it, like the Alex case study, you can see where you can systematically, very prudently minimize harm. But I guess the harm for me is you've got that individual story, but you have organizational and team stories, because teams have their own narratives, they have their own kind of mythologies and histories. I've certainly seen teams split in 2, if not more, because of these processes. We do include one in the chapter on culture. But you see the stuff have a lasting legacy in teams. And I was talking to a manager last week about a grievance process that's happening in one team across a specialist area. And they've got themselves into such a position, they're now 2 camps. The pro and against camp, and there's one person in the middle with this process hanging over them, and they won't talk to each other. So the managers are having to find ways to minimize the impact on patient care. So to me, that's also part of the story. It's the story of individuals, it's the story of systems, it's the story of teams, but particularly in the healthcare system, where people's sense of who they are is often linked to what they do. I'm sure that is the case in other sectors, but particularly in healthcare, you see the richness of that impact, and therefore the stories are quite powerful.
Yeah, no, that's really interesting. And I suppose we can talk more about the extensions of these ideas outside the NHS towards the end. But I was just thinking about the very particular nature of the NHS and of the kind of grievances that are likely to come in. Because, of course, this is an organisation that's working with some of the most intimate and charged parts of our lives, isn't it, as patients, and of course as employees and so on. So it's not surprising in a way that the NHS would be a cauldron for these kinds of emotions, I guess. Now, the obvious question that follows from what you said, Adrian, and I'll ask Andrew to respond to this one, is okay, so it's a very troublesome process and lots of people can potentially experience harm as a result of this. What, in a nutshell, are you proposing should be done instead?
So just to add to the conversation about stories and that Adrian's outlined, I mean, stories are incredibly powerful. We learned that, again, to take us back to the patient safety movement, that actually there was a point within healthcare that the term doctor knows best drove healthcare. And that actually it's only over the last 20 to 30 years that we've recognised that the patient living with a condition 24/7, experiencing the healthcare system, actually has quite a lot to bring to their healthcare journey. And certainly in terms of the book and for this exercise, actually capturing those stories was really important, because we didn't usually capture the experience of the individual going through the process. It was like the process reigned, the assumption that the process was in place, there was no changes necessary. And it wasn't until you actually start asking people, what did it feel like? What were the things in it that caused you most harm and distress? What were those impacts, that we actually got our sense of understanding of where that level of harm was coming? And I guess that's just a broader learning piece that we'd say to anybody reading the book, not just healthcare, but if you're working in a corporate organisation, if you're working in local government or a university, to actually understand what it feels like to go through that process, to understand perhaps where our systems has failed somebody because they haven't communicated to them regularly, that they have dropped a ball on something else, really starts helping you understand where perhaps the change needs to be made. So going back to your question, Martin, the key thing is always to listen first. Actually, what's happening in the system? What are people experiencing? And I guess that's where change can start to come about. So I think for us, a really key part, and that's where it kind of started alerting us to where some of the real well-being challenges were for people. So for those leading the investigation, it was a process, taking somebody through it. But for the person experiencing it, every missed deadline of a letter or of a communication would send somebody into major stress and anxiety. Promises made and broken in terms of that process had a significant impact as well. So I guess that's what we use to start saying, how do we run these processes differently?
If today's discussion has got you thinking, then why not take a listen to our friends at the We Society, a chart-topping podcast that looks beyond the politics and headlines to explore the intangible connections that hold us together. In each episode of the We Society, journalist and author Will Hutton invites leading thinkers to share the evidence for how we can build a fairer, more connected society. Guests this series include Professor Lucy Easthope, former guest on this podcast, talking emergency planning. They also have the likes of Professor Tim Grant on the power of forensic linguistics and travel journalist Simon Calder. So if you're ready for research-led insights on ideas that could change the way we live, please consider the We Society for your next listen. Find the We Society now on Spotify, Apple, and all major podcast platforms.
There's an interesting echo for me here that, my background's in sociology. And I think one of the turns in sociology that we've seen over the last 20 or 30 years, I guess, is towards this idea of giving voice. Mm-hmm. So quite often people whose voices aren't heard, women, people of colour, whatever, are then kind of seen to be providing the possibility of that voice then opening up a particular kind of process or understanding, and that potentially leading to some kind of social change. And that's, Andrew, pretty much what you're saying, I think, on that, isn't it? That the telling of the story then becomes a really important opening for potential change. Adrian?
Just to pick up on, I guess, your question. One of the things Andrew and I have experienced a lot when we've done training, so we've worked with a lot of other organizations to help them think about these processes. Its own right has been an absolute joy because of that kind of cross-organizational learning, so local government, other NHS systems. So for us, there's something about, okay, so what are you trying to achieve from using this process? So we've evidenced, so we've pretty much created an evidence base where there wasn't one, evidencing impact. So it's out there. It's now within access to anyone wanting to look. Can't say it doesn't. And we reflect that the impact is both individual and systemic, both economic and financial. So thinking, okay, so this is a big deal. But what we encourage people to think about is not that these processes should be banned, because actually that's nuts. They have a place, but it's, do you appreciate the impact, and therefore do you make sure you are using them appropriately for the right type of end? So what is your output? What do you want to achieve through this? Whereas I think historically we've seen it's just the thing you do. Well, actually, there are far more useful ways of responding to, I guess, behavior, let's say, that is, and we may want to talk about this a little bit later, that is unwarranted or undesired or something that is culturally or organizationally boundary violating. But there are a million ways to respond to it much more constructively if you approach it slower and with more nuanced approach. So you don't just get the biggest hammer out the drawer and use it, because there's a consequence. Now, I think we're into that space. And once you're into that space, you're thinking, okay, this actually is also about business. It's about good business, using resources, protecting resources. So we've moved away from, evolved the thinking that this is just about being nice to people, because you don't want to put through something that's a little bit stressful. We're way out the realm of that. This, we know that this can kill people. It's been dramatic, but there are cases where this has led to death or significant life-changing injury. But actually, it's just going to make life miserable for everybody. So if you don't have to do it, don't. And if you have to use it, how do you mitigate? How do you use it more efficiently to be better at your business? And I think that's that's the space we're in, both the moral place, but also this is really sensible business. Would you agree, Andrew? I don't want to over-egg it, but there's that interesting balance we're trying to kind of strike.
Yeah, certainly. And I guess one of the key words that, Martin, you keep hearing come up from both of us is that system approach. I guess when we started this, we thought, again, that it was very much around changing the process, kind of in the corner of an organisation. But actually, this is about how systems work. And I guess when we continued listening to colleagues and certainly started listening to managers who were responsible for, say, the fact-finding part of an exercise to make a decision as to whether a disciplinary policy should be enacted, actually listening to them, we started to get their backstory, and there was a lot of fear that they felt that if they didn't run a formal process, that somehow or another they would get in trouble for it. So actually the default was, we have to run this process in order to cover ourselves. And of course that goes back to not just system, but culture. What is it about a culture that is saying this is the only way to address workplace issues? So, we've worked with a number of organizations, and one of the first things we say to them is, what is your data telling you? And often they bring their data and they'll say, this is how many investigations they've run over a set period of time. Okay, but tell us how many have led to no sanction. And that's always a clear measure for us. And often the number of no sanctions is incredibly high. In a lot of the organizations we work with, is 50-60%. So we're putting people through a process that we know to be harmful, that we know can cause major anxiety, and yet the data's saying we could have addressed it in a more informal way. But actually that came about because it was about understanding how the managers were thinking and operating. So then this isn't about changing policy. This is about what is the culture of the organization and how is that impacting disciplinary policy and process. So when we work with organizations, we'll say, you need your exec team on board. Your exec team need to sign up to what we've called a last resort approach. And that's not about removing the process from the organization, but it is about being respectful of it and saying, we will try every other option before we press the formal button. And when the exec team say that, managers then hear a different message. Oh, right, we don't need to cover ourselves by going down the formal process. Actually, the top of the organization is saying, we want you to try all the other approaches before you press that formal button.
Which sounds thoroughly sensible when you say it like that, doesn't it? But I think it's really interesting to think about this from the perspective of the manager who, that phrase covering your back or covering your ass or whatever is very often, my experience, and I'm sure in yours, a real motive factor for people in terms of engaging in these kinds of processes. Adrian.
Just to build, really, I guess if you think about culture and you're thinking, well, okay, so what should an organization's, what are their most critical outputs? So you think, okay, so if you're working in safety critical systems, NHS is not the only one. What you want is, ability to learn, ability to spot error, ability to evolve practice. If you have cultures where there's poor psychological safety, or there's anxiety or fear around admitting you've made a mistake because it might lead to a process that we know is harmful, odds are you don't. So what we've also noticed is the more thoughtful approach to these processes can also help a system learn and feel safer. So that's great business for everybody. I guess as in the context of that, we're also noticing how this might support a leadership culture and also a kind of a desired culture where people are more likely to thrive than just basically survive. These are all high level, highly desirable corporate outputs. and pretty tricky. But for us, this is a important cornerstone, because if your employees are frightened of saying they've made a mistake, you're in trouble if you're in a safety critical system.
Yeah, just so. The other thing I was thinking here, because obviously I was thinking about the application of this to universities as well, which are, increasingly systems working at scale, is the question of scale, because there is something going on here, particularly in an organisation as large as the NHS, or rather a kind of almost like a pile of organisations that makes up the NHS, isn't it? About the way in which policy and procedure then becomes enacted with less regard to particular sorts of contexts. Yeah. So in other words, if the policy says something, presumably it has to be applied in every single context that you're talking about, even though those contexts might be very different in terms of the workplace cultures or the nature of the safety critical systems or the kind of patients or whatever you're getting through. Yeah. Adrian.
Yeah, I mean, that is a fascinating one, I guess. So from my experience, and Andrew, definitely tell me if I'm getting this wrong, and certainly with greater exposure to HR colleagues, there's often a lot of interpretation allowed or possible when it comes to kind of going from theory or policy to practice. I guess for us, that was quite an interesting revelation. But it also suggests that this decision-making will be affected by local culture and tolerance, particularly tolerance of risk. So just in the same way that we would only work with organizations where we have exec sign-off to make this, to authorize that and make it permissible, to allow their HR practitioners and their managers to actually take some risks and to consider alternatives. So I imagine systems where that are, I guess, let's just say, very sensitized to risk or particularly threatened, or where there's low psychological safety, it's probably going to be trickier to be flexible. There's going to be more rigidity around implementation of this is how we do it, and less tolerance around the grey. Now, what we've seen is there's a lot of value in those individual appraisals of the context, which you get if you spend more time looking at the context before you get the hammer out the drawer. But I'm a realist, and some organizations will have very limited tolerance for that. And it might be the universities, because we all know that universities are wonderfully happy places to work in at the moment.
Certainly are.
There might be a correlation between that and practice from an HR, people, policy, implementation. I would not be surprised. So part of our work, and this is later thinking, is this also a cultural intervention? And Andrew kind of talked about it. We think it is, but it wasn't how it started, but it always needs to be to get in there. But it's more likely to take root in the system that is receptive rather than one that is kind of terrified of threat.
And just to be clear here, the distinction you're making here is kind of an old one between culture and structure, isn't it? So the idea that structure is the kind of the bureaucratic aspect of the organization and is comprised of a set of rules, policies, procedures, and so on, whilst culture is people's attitudes, in part, those attitudes towards those rules, something along those lines.
That's really interesting. I mean, to me, that is, it's the balance, isn't it? It's kind of which is more dominant and which do you prioritize the most. And I guess we know bureaucracies have their own psychosocial function in a system, and sometimes they're intentional, sometimes they're not. I would say some systems become more bureaucratic as a result of their perception of threat, and therefore that influences culture. I think it goes both ways, but I'd much rather culture to be set and then intentionally shaped, and that to change the bureaucratic processes than the other way around. But I think, I'm not sure how many people would look at the whole system to make that intentional. I think these things happen with a lot less intention.
I think they do. I mean, that's the nature of systems, I guess, isn't it? Is there are unintended consequences that no individual actors are necessarily responsible for or even conscious of. Andrew.
Just picking up in terms of the policy level, I think we've got a major problem with policy, certainly in terms of policy design. So we've been undertaking a review of the NHS Wales disciplinary policy, which serves the 70,000 working population of NHS in Wales. And when we started it, we thought, what does the literature say? What is in the literature to say what does good policy design look like? What does good process look like? What does good application look like? And we undertook a rapid evidence review and found very little out there. And I think that's quite staggering, that actually we will be running thousands of disciplinary processes every day around the world, and the HR academic side hasn't got an evidence base for how they are run. And for me, somebody said to me recently, in terms of one of their policies, they said the problem with this policy, Andrew, is that it doesn't carry a health warning, because the policy has been written purely from a process perspective. This is about pushing somebody through a process, but it doesn't have any consideration for the impact of that process on that individual. So, we've talked about systems, we talked about cultures, but actually policy design plays a big part in that, because actually our managers and our HR colleagues and organizations lean very heavily on that policy when they are delivering these processes. Those policies need to change to reflect some of the harm that we've talked about, and that address what we believe are the two key parts for a good investigation: good adherence to policy and process, but also a recognition that we need to provide a much better duty of care and support to the individual going through it.
Fascinating. In the last few minutes that we've got available to us, let's just expand this out a bit, because there's a danger, I suppose, that some people might think that this is just about the NHS or just about the public sector or something like that. But I think both of you were suggesting to me that you see the application of some of these ideas in all sorts of organizations, public and private sector, and presumably voluntary third sector organizations too. So, Adrian, do you want to say a little bit about how you can see these arguments playing out in other domains as well?
I mean, we've certainly had conversations with people from all sorts of different sectors, and there's generally been consensus we have a problem with this too, which is both reassuring, but also, I guess, makes you a bit worried. But, I think it's back to these, the balancing of these really difficult things, particularly around, culture of organization, the state of their policies, how they have historically resolved employee relations issues, let's just say. I think that will be, each sector has a different thing. We say in higher education, there'll be traditions that are adhered to, and policies and practices and cultures that exist. In industry, there'll be other ones. I guess where you have the central denomination between, it's not even the right expression, but you have the central kind of mechanism, which is a person employed to perform tasks for remuneration. I guess you have the requirement for them to engage in a team to deliver an agreed output. You have that dyad, don't you? You have the employer and the employee, and you are then in that space. Well, how does the employer respond to the employee if they transgress a boundary, be that overt or covertly? I think we're suggesting that what we're learning is applicable to any relationship where you employ somebody, because by virtue it would, because you will have an approach. Just some organizations are probably really good at it, and actually are probably doing what we're suggesting already without even, without any influence from us. Not that we're influencing everybody, but some people are already ahead of the game. But it's because it's how they design their work and how they design how they want to shape their working experience, and possibly even linked to their understanding of what they need their employees to do. But I guess in our experience, a lot of people are stuck and they get caught up in this. How do you respond to boundary violations from an employee? Even if it's, I guess the irony is that often there are no boundary violations, it's an assumed violation. But how do you, and you mentioned it in your kind of prologue, how do organizations manage people within parameters that is agreed to be acceptable? And how does power play into that? How does the psychological contract, how does the nature of the work kind of influence that? And I mean, it is a fascinating kind of area, but I think it's good business to minimize waste.
Yeah, I agree, absolutely. And for me, my background in organizational sociology and so on, It seems that you're pushing against something quite fundamental about the nature of discipline and consequently the nature of organizing, something along those lines. Because it's very difficult for us to imagine any organizations in which there is not some kind of disciplinary process in order that everybody's swimming in roughly the same direction. But at the same time, you're pointing to the huge forms of damage and waste that are being caused because of the kind of, to me, rather sort of ritualistic or defensive versions of that process. Drawing to a close then, Andrew, who would you like to read this book? Who do you think is your audience here?
We've got a number of audiences we'd like to be reading the book. I think we had this sense that it would be great for the future HR professionals, those that are studying now, to be reading it. Do you know what's particularly interesting about this whole subject is taking a step back. It's only just been under 30 years that formal legislation came in to say that organisations should have a disciplinary policy in place to run within their organisation. The ACAST guidelines only came out in 2009 and then were updated in 2015. So it kind of feels we're still in an experiment around the disciplinary policy and process because it's still relatively new if we look at kind of policy design, development and application. So in terms of readers we'd like to read the book, we'd really like the students coming in and kind of not necessarily be informed by the old practice of simply following process, but as I said earlier, you know, bringing process and a duty of care together so that we run the best investigations, not just for the person going through it, but actually for the good of the organisation as well. We want good investigations to highlight learning, drive out error, and to make organisations more safe, effective, productive, profitable. So, you know, we've got a new generation coming through. How do we help them understand it? You know, we want HR colleagues that are working and operating in the system today to be reading it. You know, they've got a challenging job. The demands on HR colleagues are increasing. We know from reports in terms of the CIPD, they're under significant pressure, their own experiencing kind of mental health stresses and pressures too. And somehow, I think the processes, the way that we run them at the moment, contribute to that. That actually we put our HR colleagues under pressure because we've never stopped to think, is there a different way to apply disciplinary policy and process? But I guess the key group that we'd like to see reading this are the HR leaders and the HR profession. We've harmed a lot of people over the decades through the application of disciplinary policy and process. Sometimes for basic things that we've just focused on the policy and process and not realised we're putting a human being through it. This book, we hope, will be a change that actually HR will say, yeah, we've got this wrong. And this book is certainly not about pointing a finger or apportioning blame. That's what we learned from the patient safety movement. This is about being curious about, can we do it better so that it improves the outcomes for employees taken through it, their organisations, and even our HR colleagues.
Wonderful. Tremendous summary, Andrew. Thank you very much indeed. So that was the Transforming Society podcast. My name is Martin Parker from the University of Bristol Business School, and we were talking about Under Investigation, Transforming Disciplinary Practice in the Workplace, published by Bristol University Press, edited by Andrew Cooper and Adrian Neal. That was a wonderful conversation, really interesting, and a fantastic example of the way in which practical problems, you know, which we might initially think of as being quite small, quite detailed things, rapidly scale out and become kind of major questions for the way in which we think about organizations and organizing. So thanks very much for listening, everybody. If you want to know more about the book, have a look at either the Transforming Society website or the Bristol University Press website, and you can find details there. Thanks very much for listening. Bye-bye.